Hello everyone, here we are with the fifth episode and the season finale of Women in Work, Why It Matters, brought to you by the International Center for Research on Women and Feminism in India. I am Purnima.
I'm Nilanjana.
And we're your hosts. Nilanjana, can you believe that this is our last episode?
I really can't believe it, Purnima. It's been such a fantastic journey over these last, 4 episodes and in fact, 5 episodes. And today we are at the last episode. And I really find it so wonderful. We have learned so much. Really, really amazing.
You're absolutely right about learning so much, and we've had such a wonderful season. We've talked to some amazing guests about very important issues like paid and unpaid work, domestic work and domesticity, the informal economy, and the relationship between gender, caste, and work. And today, for the final episode, we have with us again two very special guests. We're talking to Sneha Sharma and Kirabo Suubi about how women's work has been impacted by COVID-19, especially the women in the informal economy. Nilanjana, why don't you tell our listeners more about the episode and our guests today?
Yes, Purnima. So today's episode will focus on the unique challenges faced by informal women workers and how these were further aggravated by the COVID-19 pandemic and the associated policies. We would also touch upon a pathway for building back better if we want an equitable recovery for all. And to discuss all of this, as Purnima said, we have two fantastic guests with us. We have Sneha Sharma, who is a Senior Research and Program Associate at ICRW Asia, where she works on gender inclusion across thematic areas of women's economic empowerment and livelihoods, adolescent empowerment, health, and family planning. Sneha is currently anchoring the India research for the Rebuild project, and she was also previously engaged in developing the world's largest sex disaggregated COVID-19 data tracker. So welcome, Sneha. It's wonderful to have you here with us.
Thank you, Nilanjana, and thank you, Purnima. It is, a pleasure to be here and discuss these issues with you. I think it's a very important point to bring up. So thank you for bringing me here.
Thank you, Sneha. We also have with us Kirabo Suubi, another fantastic researcher for this episode. Kirabo is a gender economist for Africa region at the International Center for Research on Women, that is ICRW. During her professional journey, Kirabo has conducted empirical research as well as advocated for evidence-based practical solutions to inform policy formulation. She has contributed to projects that have enhanced equitable access to justice for women and children, aimed at reducing gender-based violence in the West Nile and northern regions of Uganda. The programs have promoted social inclusion, women's economic empowerment, improved sexual reproduction and health rights of women, and community sustainable livelihoods in central and eastern Uganda. Welcome, Kirabo. So honored to have you here with us today.
Thank you so much. I'm really glad to be hosted and to, share ideas with everyone, especially talking about what is happening in the Africa region.
Great. So over to you, Purnima. Let's jump straight into the main issue of the episode today.
Absolutely right, Nilanjana. I also want to get to it straight away. So without wasting too much time, Sneha and Kirabo, I want to know from the both of you, what do you think was the impact of the COVID-19 fallout on informal women workers across India, Kenya, and Uganda?
So yeah, Purnima, I think, this is a very important point to bring up, the fallout of the pandemic for, women workers and the informal economy. If you see India, it is largely built out of workers working in the informal economy, and we have a huge urban population of the informal workers. As we see urbanization, we generally look at it as a development process, but what we often overlook is the deep inequalities that it perpetuates. So through COVID, we really need to, not just COVID, but also we need to understand what were some of the pre-existing vulnerabilities. So if we see the urban female workforce, which is about 85% of them are part of the informal economy, that means that they do not have any social security benefits. And this is not just in their working life, but this also sort of translates into their other aspects of their lives. So you see that they, because of their migrant status, since most of these are migrating from different parts of India in search of better opportunities in the cities, because of their migrant status, their insecure jobs and the low incomes, you often see these workers living in informal settlements in this inside the cities, where we are devoid of civic citizenship. We do not have they do not have access to sanitation or access to hygiene. Primary healthcare is not available to them. So there are so many issues that already existed, and add to that the pandemic and the COVID fallout. We just see them being further marginalized.
What do you think, Chirabo? What would be your view on this?
We see that COVID-19 pandemic is absolutely unprecedented. And looking at informal women workers or informal workers in Kenya and Uganda, we see that first of all, in Africa, 89% of women in sub-Saharan Africa are typically informally employed, and for Kenya, these 83% of the labor force is informally employed, and 86% of these women are in the informal sector. For Uganda, 87% of women are employed in the informal sector. So the fallout from this was really huge and unprecedented, because we see a lot of job losses. We see that the businesses owned by women were really affected, and there is a lot of gender, or there is already a lot of gender-based discrimination and inequalities in the workforce. So this was further exacerbated by COVID-19 impact. There is already lack of social safety nets and protection for this kind of women who are working in the informal sector, and because of lack of social safety nets, many of these women, when they lost their jobs, they had to find different coping mechanisms for them to be able to sustain their livelihoods. And also, women's low bargaining power already in the informal sector was further exacerbated by the COVID-19 fallout, that many of them were cut off from their jobs, and they had no places to go to for legal redress because they don't have contracts. So it has been really challenging.
Thank you, Chirabo. Thank you, Sneha. I mean, these are really, really important points that you make. And I think it's very critical to understand that it is not just COVID-19 and, the associated crisis that led to such vulnerabilities. There were already pre existing vulnerabilities. And for the majority of women employed in the urban spaces, because of those lack of access to social security, safety nets, etc. What I'd like to learn further is when COVID-19 pandemic hit, what were some of these specific challenges that these women workers faced, and how were their pre-existing vulnerabilities aggravated during this period? So Chirabo, could you tell us a little bit about your experience in Uganda and Kenya?
Yeah, so we've seen that in addition to the intensifying effects on the economic conditions, the pandemic and its containment measures further strained gender relations. So the gender relations were further in the informal sector. There is already deeply entrenched gender inequalities in Africa, and specific to Kenya and Uganda. But the containment measures put in place by the different governments further aggravated the risks for sexual gender-based violence amongst these women groups. The lockdowns we see that the lockdowns challenged traditional gender roles, where men are often breadwinners, but their businesses were affected, their jobs, their incomes were affected, there were income losses. This reduced their ability to effectively fend for their families, and we saw that there was a lot of cases rising on domestic violence and gender-based violence. This is even evidenced by a UN Women report that mentioned that uncertainties and frustrations during this particular period led to men expressing their emotions through anger, violence towards their wives and children. Of course, in addition to the loss of livelihood, sources of livelihoods, and poor access to the routine support networks, um, really affected informal women workers. And also, we saw challenges in accessing health services, sexual reproductive health services, and GBV services for these women, like shelters, because they were locked away by the people who were torturing them.
Right, Kirabo. In fact, I think in India too, we did experience a very sharp rise in cases of gender based violence. And I'd request Neha to reflect a bit on some of these specific challenges that informal women workers faced in India during the COVID-19 pandemic.
You know what Chirabu shared about Africa, it sounds, specifically Kenya and Uganda, it sounds very similar to what was happening in India, where economic challenges that women were facing, it just intensified. And for them, just being able to manage their households, being able to even ensure that there is food and nutrition for their family members became such a big stressor for them. So this sounds quite similar to what was happening in India. And of course, there was an increase in gender based violence. Women were not safe at their homes, even though they were confined within their homes. They didn't have their support network that they usually tap on. And of course, adding to that, there was stress from their partners or their spouses and their family members, because they were also going through economic challenges and economic difficulties. And adding to all of that was that stress was adding to how they were channeling that out into in a violent situation, in a way of violence towards these women. So that was happening. And women workers or informal workers, when they completely lost their jobs in lockdown one, even when they were going back and trying to start their jobs again or start their work again, they faced harassment from state actors. We had instances of street vendors talking about how they were harassed by policemen, by the municipal corporation officials in Delhi. They were being fined. They were not allowed to put up their stalls. So all of this was happening, and this was adding to their stress. Even for domestic workers, we had instances of and narratives that we heard from them about facing stigma from their employers, from the resident bodies, from societies. So the violence that they faced was not just limited to their household, but it was also happening in public spaces, from the state, from their employers. So overall, if you see, there was an articulation of them feeling stressed, them feeling anxious, and also feeling the feeling of loneliness, because they didn't have their support network that they usually have. Like, they were not allowed to, their mobility was restricted, so they were not allowed to meet their family members, their immediate family members, or their friends, or workers in their that they usually meet. So if you see all of this, you would realize that how difficult it would have been for the informal workers during this time.
Yeah, what my colleague Sana has just said, we see that some of those instances are really similar to what happened across Africa and specifically to Kenya and Uganda. We recently, in the Rebuild project, did some case studies, and these were mainly focusing on informal women workers, representatives telling us their experiences during the pandemic and now and how they are coping. But many of these women told us that their experiences, for example, in Uganda, the president of Uganda gave a directive during the pandemic and the lockdown that women who operate in the markets should sleep in the markets. So they are not allowed to go back to their homes because we want the government wanted to reduce on the transmission of COVID. So these women were required to sleep in the places where they work, but they lacked amenities to really enable them to be comfortable with such a position or a position that they were put in. They did not have mosquito nets. The sanitary situation is not good at all in the markets. They had to find where to sleep in their workplaces, and then operate from there as well. So many of them decided to sleep in the markets. But again, there was a transport there was a restriction on movement with transport. So even though they stayed in the markets, they faced a challenge of customers going to them because customers did not have adequate means to travel to the markets. So we found that most of their goods, especially those that are perishable, got spoiled, got rotten. So and most of these women operated on loans, so they faced quite huge losses, in terms of finances.
Thanks, Kirabo. I think you and Sneha very rightly pointed out how tough it has been for informal workers, especially informal women workers during the pandemic. And Sneha, you've done some amazing work with ICRW Asia in India. But I want to know, like, based on your experiences of working on Project Rebuild in Asia, how would you say, was the state's response to this? And did it exacerbate or address these issues that we've talked about?
So, when the pandemic hit, of course, the first response was to control or to mitigate the health cost of the pandemic, which of course took a precedence over other things. So there was lockdown and containment measures to be able to stop the transmission of the virus. So, if you look at that, if you look at the current makeup of the country, where 80% of the workers are largely informal, so with the lockdown, while there were organizations and there were occupations that adapted itself into work from home situations, for most of the workers that was not a possibility. So what happened was they lost their livelihoods, they lost wages. In some cases, they were only earning half of what they would generally earn. So fallout was that they didn't have anything. So of course, for this, there was an introduction of cash transfers, free ration from the government. So cash transfers did help, or did help them tide over some of it, but it was not sufficient to meet the basic needs, or to meet the full basic needs that are required in terms of food, in terms of rent, in living in cities, in terms of other services that they need to access, or basic utilities that they need to access. But what was most helpful for women workers, or at least what really helped them, was the free ration that they received. What we have also seen is that the situations differed in first lockdown and the second lockdown. In the first lockdown, a lot of them depended on their own savings and the cash transfer and free ration. So free ration was mostly accessed during the first lockdown. In the second lockdown, they because the situation had still not improved, and then we again had a massive outbreak of COVID, where the health systems completely collapsed. So within that, of course, they were not able to go back to their jobs and get back to the pre-pandemic levels of their earnings. So they then depended on on borrowings or selling or pawning of their jewelries or other assets. So that there was that kind of difference also. And in terms of the services that they accessed during the second lockdown, it was even more difficult for them to access ration or cash transfers, because they themselves were going through a health crisis at home. So not a lot of them had the opportunity to go and stand in queues to be able to take this free ration. So they depended a lot on civil society organizations that were running free kitchens or community kitchens. So that was also happening. While on the economic measures, of course, we had a lot of things from the government of India. uh, what was important was that apart from this, there was also, as we have discussed, that there was an impact on GBV. There was like increase in their experience of GBV, gender based violence, and the fear also increased. So for that, we did have helplines, and there was continuous announcement of helpline numbers coming in and helpline numbers being active. But what was important, or what is still to be seen, is how were these women who were in such situations, how were they rehabilitated, or how were they, uh, you know, if there was any redressal in terms of their needs. So that is something that is still to be explored on ground. What happened after they reached out on helpline numbers? What happened after that? So that's something that we are still trying to explore. So that was on GBV, and of course, health services, because health services were focused on managing COVID. The women workers who are largely dependent on frontline health workers like ASHA here in India, they were facing massive crunch, because ASHA workers were all diverted into servicing for COVID 19. So, other services like reproductive services or family planning services, all of this had a massive hit. So, that's also something that still needs to be explored, that what happened to women workers, and what will happen in terms of their outcomes, their health outcomes, over the few years, where we see that, were they able to access abortion services, were they able to access family planning services, or antenatal care or prenatal care. So these are some of the things that still need to be explored. So for economic measures, we had a lot from the government in India, or government of India, but there were other needs for women that were not adequately addressed.
Yeah, thanks, Sneha. I think you've shared some really interesting insights. And Chirabo, you too have done some great work with ICRW Africa in Kenya and Uganda, and you also work on the project Rebuild in Africa. So, what do you think about this? And was the state's response in Kenya, Uganda similar to that in India, or was it different? I would like to know more about this.
So on the rebuild project, we've done some scoping studies. I mean, we've consulted with experts in the field of gender-based violence, sexual reproduction health, and livelihood social protection to try and understand um, the state's response and how this has affected um, the informal workers. So we see that I'd already talked about that the effect of these containment measures led to loss of livelihood, because most of people in the informal sector lost their jobs, lost or had their income reduced. There was poor access to the routine support networks, because now everyone was locked up in their homes and they could not reach out to their usual networks for support. We saw there was a limitation in, or a difficulty in accessing health services, and especially for women, the sexual reproduction health services like antenatal, family planning, maternal services, and then, of course, the increased exposure to gender based violence. But besides all those challenges, the government sort of really thought through and came through to support their populations, especially the vulnerable populations. They put in place some social protection measures. We saw food rations being given out to vulnerable households during the lockdown period. Though also this one here had challenges that it was not adequately targeting people in the informal sector who are most vulnerable in terms of the coverage, that very few of them received this assistance of food rations, in terms of amount, that even those that got the food rations, 3 kilograms of posho would not really sustain a bigger family for a long period of time, like the kind of lockdown that we had. But we also saw government efforts put in place with COVID recovery funds and stimulus checks given out to targeted populations. But we see that there was a challenge in targeting well the most vulnerable of the populations. Most people did not receive these COVID recovery funds. And even those that received, again, this amount was really meager, that it could not support the family through these weeks and months in which we were locked down and people were not able to, to go source for jobs and cover their livelihoods and sustain their families. But we besides when you look at the rise in GBV, governments also came up with measures to try and because they saw the adverse implications of the measures that had been put in place amongst the vulnerable groups. So the governments came up with dedicating toll-free line to provide rapid response GBV services across the country, for example, in Uganda. But some of these victims or survivors had challenges getting to even making these toll-free calls because maybe someone does not have a phone number. Sorry, they don't have a phone. They don't have a phone, or they were using a neighbor's phone, and now they are locked away from their usual social networks, or their phones have been taken away by the perpetrators of these violence. And even those that had access to the shelters sometimes were at a distance, and it was a little bit difficult with a restriction of transport to be able to reach out to these shelters. But we also saw that there were overflowing numbers at the shelters. So the shelters were no longer sufficient enough for these GBV survivors. So there is still a lot to be done. There was a lot of fallout with the measures put in place by governments, but again, the governments tried so hard to be able to make positive responses to support the populations. But again, there are a lot of gaps that remain to be addressed in order to really protect the informal sector and other vulnerable groups, and especially women in the informal sector.
Thank you, Kirabo. Thank you, Sneha. I think these are great points and very important observations across these three countries that you've made. And so much is similar, I think, in terms of the experience. Going forward, I think a very critical question that all of us are asking is that given this set of vulnerabilities, given the kind of state responses that we have seen, how can we think of a gender equitable recovery path? And how can we think of rebuilding the economy better? From your experience of talking to these different categories of women workers and understanding their needs, what would you think is the best path that we can adopt in this context? Sneha, over to you. Your reflections, please.
Thanks, Nilanjana. And I think this is a very important point of what we are also trying to do is trying to assess what could be a way or a pathway for a more gender responsive recovery. So within India, I would also like to point out that historically, if we see, our social welfare schemes have largely been focused on the rural economy. Even within our pandemic efforts or the economic measures that were released by the government of India, there was a large chunk of money that went for Manrega, which is focused on the rural economy. So while we are talking about the urban poor, it is very important to talk about that there are very few policies focused on them. So there is a need to look at urban poor and urban informality holistically, and also the women who live here, and try to see that their lives are not just their work, but also it translates into how the living conditions that they live in, or what the living conditions are for them. And so having more directed policies that can address some of those needs that arised out of the pandemic. So that's one of the things that we really need to look at, like look at urban informality holistically. And the other thing is to or the basic thing is to have a sex disaggregated, uh, like a mandate to collect sex disaggregated data for policies, mandate to collect sex disaggregated data for health, for economic measures. I think just having data would help us understand where are we lagging, or what are some of the areas that need more focus. So for us to be able to actually do evidence based decision making, there is a need to have data and publish that data in the public domain, so that those the organizations or the practitioners who are working with women workers, or who are working on this, could actually use this data to enhance their programs, enhance their work. So that's also something that we realized within our analysis, because our analysis largely dependent on reports and articles and surveys and some narratives from the women. It would have been even more stronger if we had data on the policies and what the policies were actually, how it looked like on ground, like how it was being implemented on ground, and how women were accessing these policies on ground. So it might have looked like a completely different analysis if we had that kind of data. The other thing, of course, is to have the policies that we are talking about, or the responses that we are talking about, to have an integrated gender lens. While we are developing policies, there is a need to already anticipate what would be some of the unintended consequences for women, or for other marginalized identities, so that we can further avoid further marginalizing them. So as we was talking about the containment measure, and how the fallout of that has been so massive on women workers. So if a policies, while they are being developed, if we could already anticipate some of these needs, some of these fallouts, and of course have a better response to these fallouts. So that is something that needs to be done. And through our research, or through our research in the next phase, which is going to be a large scale survey with women workers, like 1400 women workers. So we are trying to ask some of these questions, like ask what are some of their needs, what happened when policies came out, how was their access looking like. So with our research, we hope to be able to send some recommendations, or set some recommendations for a more gender responsive recovery for them, and for even other workers in other areas.
Thanks, Neha. Thanks. These are very, very important observations. Thank you. Chirabo, what do you think would be a gender equitable, gender responsive recovery path for Uganda and Kenya?
Yeah, absolutely. My colleague Sana has already talked about, making sure there is a gender lens in all the policies that are being formulated and implemented. Yeah, so I would recommend, or we would, as ICRW on this review project, we recommend policy integration and reform. That is reviewing the policies specifically on social protection, to be able to support workers in the informal sector, and to incorporate clear measures on how this particular group of people can benefit from social protection measures that the country decides to put in place. For example, extending social insurance mechanisms to the informal economy workers. We would also recommend, establishment of social and labor registries. Social registries have been used world over to select suitable recipients of social protection programs. For example, we can draw learnings from the Gambia Social Registry. There is also a program running in Ethiopia. I think it's called Productive Safety Net Program. We can draw learnings from that. So adopting social and labor registries purposively for, being able to reach out to targeted groups of people, this kind of campaign will significantly enhance the effective delivery of social assistance by different actors. Also looking at partnerships, government cannot work alone, but strengthening state and non-state actor partnerships, where we have a government, we have the CSOs, we have religious organizations. When we have this kind of concerted efforts amongst all the actors, and they come together to provide technical governance and financial support, this absolutely improves social protection mechanisms and actions, and we request that this be directed towards the informal workers and, of course, other vulnerable groups in the population. The one thing I would have to say that governments and other relevant stakeholders must not only learn from the social, economic, or health crisis that the pandemic has caused us, especially amongst the informal workers. They must also begin to address the effects of the pandemic on gender-based violence. For example, we need more funding to be able to be geared and prioritized in accessing violence-related services for the victims, including shelters, services to support gender-based violence survivors. And similarly, we need to grow awareness of understanding of GBV and strengthening the safety nets for vulnerable women and children, and also improving the legal protection and access to justice for survivors of violence.
This has been wonderful. I have learned a lot, and I'm sure our listeners have also been truly interested in a lot of things that we have discussed today. What has been striking through this entire conversation is that there are so many similarities in the experience of informal women workers in urban economies across the three countries, India, Kenya, and Uganda. We understand that some of the pre-existing vulnerabilities have been the same. For example, the lack of access to social security. Also, I think a very important point that I think Sneha mentioned during her discussion is that when we want to understand the context of women informal workers, it's not enough to just look at their livelihoods or their businesses or the work they do. It's important to look at where they live, what kind of services they have access to, what is the set of civic amenities that they can access. All of these together holistically create a situation or a set of vulnerabilities on which their survival depend. So when we think of how the COVID pandemic impacted this set of workers across these three countries, we need to look at not only issues of job loss or loss of livelihoods, loss of earnings, we need to see how their access to these basic amenities and their basic survival was also impacted. So starting from, loss of homes, many people could not pay their rents, to the increase in the experience of gender based violence, to experiences of stress, loneliness, the experience of stigma. All of these need to be taken into account when we consider that impact. When we were discussing these recovery paths, I think what also came out very importantly is that while the government has actually come up with some very, very well intended policies, a major lack or gap is also in accessing some of these policies. Even if a scheme is in place, how do you access that scheme? It could be lack of a particular it could be lack of a phone, it could be lack of digital literacy, it could be lack of a support network, it could be lack of identification or registry as a worker. So I think when we think of building back better, creating these systems, creating better access, and having a gender integrated lens within policy, these are the important issues that we have to bear in mind going forward. So thank you so much, both of you, Sneha and Kirabo. This has been truly enlightening. And I'm really sad. Can you believe it, Purnima? We are really at the end of our last episode. And I'm so regretting this already, that, I want to go on and on.
I really can't believe this is the last episode, but I also want to take a moment to, thank our guests again. I think we couldn't have had better guests than Sneha and Kirabo joining us for the final episode, and it has been such a pleasure talking to you both.
Thank you, Purnima and Nilanjana. I think it has been a pleasure hearing from Kirabo and, of course, you both. And I completely resonate with what Nilanjana was saying, that situations across the two countries look so similar. So I think that has been a very great learning for me personally.
Some here, thank you so much. I really appreciate being hosted and, sharing out, dialoguing and looking back at the situation. Of course, we are still in the pandemic, but we are hoping as we're building back better that we shall find lasting solutions for informal women workers. Thank you so much.
Thanks, Kirabo and Sneha. And since this is the last episode, I also want to take a moment to thank my co-host Nilanjana for being such a great co-host and friend also throughout this series. It has been such a joy hosting with you.
Thank you, Purnima. The feeling is completely mutual.
There's also so much work behind the scenes that goes into making a podcast, and I want to take a moment to thank both the FII and ICRW teams who have also done a great amount of work in making this podcast happen. So thanks so much to all of you. And there's just one more person I would like to thank, our podcast editor and producer, Shreya Roy, who sits in all of the recordings and makes sure everything sounds right and works wonders in post-production. And to our listeners again, I just want to thank you for listening and sharing the podcast. And while this episode marks the end of our podcast series, this is not goodbye. You can always listen to the entire Women and Work White Matters podcast series on your favorite streaming platforms. And before we actually go ahead and say goodbye, just a small reminder, and actually make that a big reminder. If you like this episode, don't forget to subscribe and rate. Your ratings are very important to us. Women in Work White Matters on your favorite streaming platforms. Bye-bye, and it has been so much fun hosting this podcast.
Bye-bye to all.
The Women in Work White Matters podcast series is part of the Rebuild COVID-19 and Women in the Informal Economy project. The study is being carried out in Kenya, Uganda, and India by the International Center for Research on Women, with support from the Bill and Melinda Gates Foundation and the International Development Research Center. This podcast is brought to you by the International Center for Research on Women and Feminism in India. You can find more about ICRW's work on their website, That is www.icrw.org/Asia, and find them on Twitter and Facebook at ICRW Asia. You can also find more about FII on www.feminisminindia.com or follow FI on Twitter, Facebook, and Instagram at Feminism in India.